Thank you. Now, so Dr. Hind, I don't know, will you be noise again or free? Dr.
أنا
Hind.
يمكن يا دكتور.
Okay, wherever you are, if you are free, we can continue. So Dr. Rasha, please continue with your patient. Dr. Rasha.
72 years old man.
Yeah.
Present with a history of epigastric pain, typically of dyspepsia, which had been presented for 3 months.
Yeah.
Together with weight loss of 2 stone over the same period. He had been treated with proton pump inhibitor, but he had not benefit from this therapy. More recently, he had noticed difficulty when he is trying to eat solids and frequently vomit after meals. On examination, he had palpable mass in the epigastrium, and his full blood count revealed a hemoglobin of 85, which is normal 130 to 180. What is a likely diagnosis? Most probably this is CA with weight loss.
Weight loss. So rather in general, we like to say this is the GI, upper GI symptom with red flags, alarm signs. Alarm signs. So how many alarm signs are here? More than one. I hope all of you understand alarm signs.
Weight loss here in the alarm sign.
Yes.
Okay.
Low hemoglobin.
Low hemoglobin also alarm sign. Lump also alarm sign. Palpable lump. Okay. And the vomiting there or not? Yes, vomiting also alarm sign. Vomiting also alarm sign. So more likely this is including the age also. 72 years old. I hope all of you understood. Alarm sign means what will be the next investigation immediately right now? Diagnostic investigation. What is underlying this? Very right, very right, very right. Endoscopy of upper GI. So this is the approach to dyspepsia now, so that you can cover many of the diseases, and it's very common, doctor, even in the OSCE exam also. The dyspepsia due to many causes, and all the causes are familiar with us. So how to proceed? Check the alarm features. I will show you the alarm feature now, if the alarm features are there. Look at the right side, doctor. One by one. Alarms is the mnemonic. ALAR, like that. Alarms. Okay. Age 55, including Barrett's esophagus. So we make a mnemonic for you. Is alarms 55O. It is a little customized by ourselves. Alarms is the book knowledge, and 55 were added by us. Alarms 55O. O means esophagus. Hope it will be useful to remember all the features. So each and every feature is alarm features. So if the dyspepsia associated with alarm feature, we need to explore more. And how to explore it? Mainly by the upper GI endoscopy. And it will be the urgent endoscopy. Remember, word is urgent. Okay. And if it is no alarm feature, but age is more than 55 only, it is also one of the alarm feature in our understanding. And then endoscopy, not urgent, but as a routine endoscopy, we may plan. So there is a word urgent, there is not word urgent written here. So age is a factor. And if there is no alarm features, then the less than 55 years, test for the H. pylori and give the treatment. Whatever the test you will do, usually urea breath test is preferred. Urea breath test is preferred, but there is some limitation. I hope we will discuss a little later. And the H. pylori is positive, give H. pylori. If H. pylori is negative, treat symptomatic or consider other diagnosis. It is maybe part of the specialist understanding. You will refer the case later here. H. pylori, symptom resolve, follow up, and symptom persist. You have given H. pylori treatment, even then symptom persists, suppose after 1 month, then go for the endoscopy planning, though there is no alarm feature. I hope this is clear to you, all of you, please. If you don't understand, please quickly discuss with us. It is very important slide, very important slide. Approach to dyspepsia. I hope you understood. Okay. And now come to the test of H. pylori. Suppose patients with alarm symptoms are frequently treated with PPIs rather than being referred. Remember, doctor, it's an alert message for you. These sometimes lead to a transient benefit, which simply delays the diagnosis of the underlying tumor. A significant number of examples, doctor, I think you will face, and we faced before. That we are giving PPI, patient getting relief. We are not planning for the endoscopy, doctor. Dr. Rashad, what is your experience? Now learn from this patient. Whenever we find alarm feature, we need to convince the patient for endoscopy, doctor. Otherwise, underlying dangerous diagnosis is missed. And in our country, not in here, even the most of the countries of the world, people are taking PPI for years together. I don't know what is your experience, Dr. Hind, Dr. Rasha, Dr. Shaza, and Dr. Soha. PPI for a long time, years together.
Yes.
Is it true?
Yes,
Yes.
yes.
This is true. This is true. And this is a very unfortunate thing. Whenever indicated, we need to convince the patient for endoscopy to identify. Suppose this type of patient have malignancy. There may be other diseases also other than malignancy. So very important, doctor. Don't give PPI more than 1 month. After 1 month, evaluate the patient. If patient is not getting benefit, then think for the endoscopy. Okay. So now what H. pylori testing will be enough. Dr. Rashad, what H. pylori test did you do before?
Antibody.
Antibody. So is there any option of antibody written discussed here? Lower one. The IgG antibodies H. pylori could indicate previous infection. But what we are bound to do it, I will tell you now. But other colleague, what you are doing for H. pylori test in your practice?
Every test or stool antigen.
Yes, you can do. But the limitation is if we give the PPI, then PPI will disturb the test result.
Yes.
Because acid medias are not there.
2 weeks. Antibiotic.
Yes.
2 weeks.
2 weeks. Yes, 2 weeks we have to stop PPI. Now the things are there. Can patient tolerate these 2 weeks? If patient tolerate, I can convince the patient without PPI. After 2 weeks, I will advise for this. Otherwise, antibody test immediately can be done. If a good clinician can correlate with the clinical features with the H. pylori test, then you can do also. We are in our practice, we are doing so. But the best test will be rapid urease. Rapid urease, you see how much. But clinical, for the practice purpose, urease breath test is easily available. The rapid breath test, you see 80 to 95% sensitive, 95 to 100% specific. Specific means if the test positive means this is the positive disease. It's very more valuable. But the clinical practice, better to do urease breath test because rapid urease test is done on the biopsy. But urea breath test does not need biopsy. So considering this thing, the urease breath test is the appropriate one for the H. pylori. So thanking you, jumping to the next topic.